You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Sean Wilkie, and along with my awesome co host, we interview the innovators in this space every week. Ivan, please go ahead and get us started.
Hey, I'm Ivan Zach. Really excited to introduce a colleague and a thought leader in the domain that I'm very excited, and a friend of mine, Dr. Mark Johnston. And this is actually the second Brit in a row, so we're lucky in last two episodes. So Dr. Johnston is the CEO of VetStream and a founder of Vets in Mind Alliance. He's also the vice president of the World Small Animal Veterinary Foundation and a committee member of the British Bee Veterinary Association. With the background in equine care, Mark obtained his PhD through the confidential inquiry into the perioperative equine fatalities after working at the esteemed Rossdale's Equine Referral Practice in Newmarket. Graduating from the University of Cambridge, he began his career in first opinion equine practice in Kent. Mark's commitment to making a difference extends to his roles as chairman of the UK-based charity Our Special Friends. Mark, welcome to the show. Thank you for finding the time.
It's a great pleasure to be here. Thank you.
So, with all your achievements, the topic that we are meeting on today is the Vets in Mind Alliance. And that's how we met through this organization, which I'm privileged to be a part of and seeing it grow. Tell us a little more about what is Vets in Mind Alliance and how did you go about? Why did you think that this is something that you want to build?
Yeah, no, thank you for that introduction. Yeah, I basically have been interested in mental health and its impact on us as clinical team members in the veterinary profession, because frankly, I had a burnout experience when I was the anesthesiologist and critical care clinician at an equine referral centre in Newmarket, doing all the anesthesia and critical care at stupid hours, o'clock at night, and then having to do your day job with all the challenges of doing critical care and not really having very many others to depend on. My boss, Tim Greet, was I worked with him and an excellent nursing staff, but it's still dependent on me. And I essentially became, without realizing it, more and more in the center of an extremely busy level of practice, as high level as you could be, without any real releases. There was a lot of professional isolation. I didn't really have very many folk in the practice who were also interested or willing to share the burden of the anesthesia and things. So I basically got more and more tired, more and more isolated, and didn't really have any outside interests apart from a patient family and two young children at the time. And I basically started really hating what I was doing. And without realizing it, now, only 20 years later, of course, one finds out that some of the symptoms that I was experiencing are quite well known and described as burnout. And I really did experience it and didn't know really where to go. And it was only afterwards, about 3 or 4 years afterwards, that I really sort of cottoned on to the fact that it was something that A, I experienced, and B, a number of others did as well. But as a clinician, as sort of, I gather there's a descriptive term called a hero complex, where we as veterinarians seem to think we can conquer the world and we don't need help. And then you've got the British stiff upper lip on top of that. So I didn't need any help. I'm fine. And that's definition of fine starts with an expletive that I probably better not used: insecure, neurotic, and emotional. And I'll leave you to fill in the one at the F at the front. And I realized that actually I needed to get some help. So I've did manage to do that, did manage to change direction to being a clinician, to setting up the mouthful that you had to go through just then, Ivan, the confidential inquiry into perioperative equine fatalities, did a PhD, basically trying to find out why I had experienced a higher than expected death rate in anesthetizing horses, and did my PhD in that and a postdoc. And then realized that actually academia isn't really the place for a creature like myself. So I went into and saw an opportunity called VetStream that time by a wonderful British clinician, John Grieve, who was very far-sighted in his vision for what the veterinary profession needed to get their information. Instead of relying on textbooks, he thought we should have a handheld device that would beam information down by satellite. This was back in the late 1990s, before the internet was even dreamt of. He was very far-sighted. So I went into digital publishing. And ignoring the rest of the vet lexicon activity, my commercial activities, I realized that actually there's very little useful information at that time, about 4 or 5 years ago, about mental health in the veterinary community. So I started squirreling away information, as often is the case with digital publishers. We found information sources that I liked and pulled them together, and they might have been TED Talks about cyberbullying. It might have been, eating disorders, which I know is quite prevalent in some of the students at vet schools. It might have been depression. It might have been self-harming. It might have been all sorts of different things. And it helped my understanding of what was out there and what people were experiencing. So I decided to set up something and create the information as a resource center on an app, because I felt that the smartphone is probably one of the more personal pieces of equipment that we use, and we can use it in private rather than a desktop or laptop where people can walk past your screen and say, oh, what are you looking at? Whereas in your phone, you can be anywhere with it and have a personal encounter with the information you want without anyone looking over your shoulder. So the whole project came alive because I began to realize that coalescing all this content together was going to be quite constructive. And the more people I talked about it with, the more they said, oh, I've had something similar than you experienced. And actually, it would have been really helpful to have been signposted to where I could get help. And, that's what happened to me. I went to my GP finally. My wife led me gently by the hand and said, I think you would do well to go and have a chat to your doctor. So I did, and then managed to get support and find a new direction.
So, Mark, I want to pause there and just talk about this hero complex, because you and I we've been curious about well-being and the burnout, and we both experienced it. And then I also remember how I was pushing the hours and staying the longest that I can and being proud, telling how I did 4 surgeries today, and then after that writing notes for another 4 hours after the shift. Why do we have that? Why do veterinarians have that? And is it specific to veterinarians, or is it a type of person? Or do we select this type of person into our profession? Where does it come from?
I think there's a work ethic that I recognize in many veterinarians and many human doctors too, actually. I think we just really want to help, and we really strive for doing as much as we can. And whilst we're doing that, I think we don't very much look to left or right. So I think we get ourselves in a bit of a pickle because we don't look around and realize that we're being a bit abnormal. And to do my job, to put out all the clinical fires, if you like, in each one of the cases that one deals with, you've got to be that hero. You've got to be the guy who's applying the knowledge for each case and trying to get to the bottom of it quickly. So I think that may be in my situation, and I can only really answer from my position. That's probably where I came from, as well as being British and having a stiff upper lip and not agreeing that I had a problem at all. I was in denial.
Yeah, it's interesting. You're probably one of the best people you know. At least at that time, you were probably one of the best people you know. I've got a completely random question for you. What was your first job?
I was in primary care as a vet, you mean, a veterinarian?
No, not at all. What was your first job?
First job was driving a tractor in doing harvest on farms near my home in Gloucestershire in England. So age 16, I didn't have a driving license with a tractor. You had to go onto the road for the first time when you're passing your test with L plates, do your driving test. And then if you were lucky enough to pass, you could then pull trailers of straw and grain and things. And I did that for 3 or 4 summers. Yeah.
It's an interesting question because it speaks to this idea of where does your work ethic come from, right? And I'm sure there was some long days, and
Oh,
I'm
yeah.
sure you thought you were a bit of a hero after driving the tractor down the
Well,
down the road for the first time. Yeah, so
wanted to earn some money, and there was a lot of work out there that had to be done. To your point, Sean. So yeah, that's it. Yeah.
yeah, it's funny. It's funny you say that. I remember my parents giving me to one of their friends as probably a teenager, maybe 13, 14 years old, to go pick rocks behind a tractor and put them on a wagon. And it seems like slave labor now because I'm sure I was paid a couple dollars an hour. Mark, the next question that I wanted to ask you, a really, really interesting kind of experience and kind of how you got here. What is your vision for, this work that you're doing, and where do you think we can take this work, and where can we drive the profession? Can we solve these issues? How long is it going to take?
Uh, I honestly don't know. What I do know is that we've got some very capable people in this whole market. And I think we need to learn to listen to each other and find out what the common factors are in our experiences. I think we are slightly in need of clinical psychologists to come in and really look inside what's going on and maybe profile us more clearly, understand the mentality and the personalities that come into the veterinary profession. I think because we're trained, I think, as pretty good scientists, at least I hope we are, I think we've got the abilities to observe the symptoms and look at the signs and apply our clinical reasoning if we are of a sound mind to be able to do so. And that's lovely if you have got that. If you haven't and you're in the brown stuff, that's really a lot harder. And it's recognizing when you are in trouble or having a friend or relative to say, actually, Mark, not doing so well, are you? Come on, we need to maybe have a little investigation as to what's going on. So I think there has to be some self-care to help people who get themselves in trouble. But I think if we apply our clinical reasoning to ourselves, we can probably recognize if, as I say, we haven't gone off the rails already, that we need a bit of help. But fundamentally, I think, without getting too philosophical too soon, we've really got to help people understand what it's like being a clinical individual. You will be expected to get difficult cases and to work your way through them. You will get disappointments. We all die in the end, and some of our patients will do so, that we're dealing with at the time. And we've got to learn how to handle that, the vicarious trauma of them dying, sometimes low level of gratitude from clients. I think a lot of people also find it very difficult to talk about money and the payment required for our services. So I think there are some factors which, if we unpack with good psychological support, we should be able to get closer to what some of these issues are, underlying factors are.
Yeah, it's fascinating. I mean, one of the things that it made me think about as you were saying that is, this idea of like having enough self-awareness to know that you're in burnout. And I think it's very much like you can't see the forest for the trees when you get there. I've been burnt out as well. Took me a year and a half on a beach to kind of want to go back to work. So I've been there. I know what it's like. One of the questions that I wanted to ask you, which I think would be really helpful for anybody listening, is how did your wife persuade you to get help, and how did you get over the fact that you were this all-knowing doctor that didn't need help from anybody?
Well, she was a veterinarian too, and is, but she's not in practice herself. But I think she just recognised that I wasn't the man she married, and that I was trying to, do too much, and that I probably needed to recognise that things weren't going so well. I needed to make a significant career change. In fact, it was a bit more radical than that, really. The first step was I came back one night having decided that actually I wouldn't, even if I was offered the chance to be a partner in the practice, if they offered to be free of charge, I wouldn't take it, because I had the toxicity that I was experiencing and the mental situation that I was in. I just thought, I can't do this for another 30 years. And I also remember saying something, and this relates to, again, back to my early days, I guess, is that my father took his life when I was 10 with a gun. And my mother was, and this may be where the work ethic comes from as well, was a pretty tough lady and pretty set in her views on what was, what I should be doing as her eldest son. And so she could not have been more proud of me getting into veterinary school, coming out as an equine vet, getting to work for one of the premier equine practices in the country. And I remember saying to her, when she came up, because she came around with me on a few occasions, doing my rounds in the racing yards in Newmarket, and saying, "Oh, this is just marvelous." And I said, "Yeah, Mum, it's fine. But actually, if I carry on doing this, I don't think I'm going to be here in, a few months or years. I just can't continue doing this." And I remember her responding, saying, "Well, darling, what am I going to say in the cocktail parties I go to at home?" And I said, "I don't really give a damn what you tell them. It's my life, and I'm realizing that I'm not cut out for this." And that's when I realized that maybe I'm not doing the sort of work that I could be doing. And I don't know, I guess veterinary medicine is a broad church, and there are lots of applications. And look at the three of us on this call. We're all from different backgrounds doing different things, not necessarily doing clinical work ourselves. But there are lots of other avenues for what we can do within the veterinary profession. And I think a lot of narrow-mindedness from ourselves as veterinarians can trap us in feeling that that's all we can do. And I'm grateful.
Couldn't agree more with that, because a lot of people, I think that they feel a trap of our profession because you have to be a clinical doctor,
Yeah.
and they don't understand how broad the highway is of veterinary medicine. I mean, you can do anything with it. But I want to bring it back to Vets in Mind and the structure of it. Some one thought that came to mind. So Vets in Mind, there's two pieces to it, right? There's ample amount of resources where to go if you think you have a problem. But the first part, which I love that Donna brought to the application, is the self-diagnosing part, saying, do I have a problem? And I think it's almost like, if you think about people with something like alcohol or substance abuse, the hardest thing is to admit that you have a problem. And then that self-diagnosis, or the love, people that love you, that bring you to that attention. And then, but it's really when you truly believe that you have a problem with it, you diagnose yourself, you seek for help. But I have this thought come to mind, Mark, when you were talking about it. Do you think that positive psychology in the future could help us identify people with those traits that potentially lead to burnout in the future while we are in vet school? Maybe this is something that we could then kind of, follow the cookie crumbs and come back to the place where we actually know the people that are more predisposed to burnout and prevent it earlier.
I think it's absolutely vital that we go back to grassroots, Ivan. I completely agree. I think the small number of people that can get into veterinary school means that there's a very elite number. And in the UK, anyway, one of the only ways that you can select people is to select the brightest, with the best grades. That's not really entirely what we need within a practicing profession and the rest of the opportunities for veterinarians. I think that there does need to be a broader consideration of where we could be with a qualification as veterinarians. I think in vet school itself, understanding our personalities, the psychological profile of us. And that's one of the things I've only discovered in the last maybe 6-7 years from Alan Robinson and Vicky Robinson, was to do a personality profile. And it turned out that I absolutely am a screaming creator. I love new ideas and going off on mental excursions on particular topics. I absolutely hate doing the same thing 15 times a day. So was I designed at all to be seeing 15 cases a day, 15 lame horses, 15, pets and things? Absolutely not. And so I was trapped in something that was just not suited to me. So I think we need to understand ourselves and our own personalities. I think Jason Spendelow in Harper and Keel, one of the new vet schools in the UK, is trying to help people build a wellness kit around them as students. I think that understanding ourselves more and what we need to do for ourselves is critical, and also to recognize when one or more of us in a group, in a practice, are slightly coming off the rails. So I think going back to grassroots is really, really important.
I'm always making this analogy, which I hope the veterinarians that listen will forgive me for, but it's almost like traits that we breed into the dogs when we're looking for, that English bulldog with a huge face and the stance, and you get the narrow nares and the trachea and the whole brachycephalic syndrome along with it, or beautiful golden with all the hip dysplasias, and like whatever. We were selecting people for certain brilliance to become veterinarian, but we brought along this dark matter that comes with a certain group of people. So it's interesting to see, is it even how we select people for the vet school? It's just I think it's coming all the way back there. But sorry, Sean, I interrupted you. Go ahead.
No, it's totally fine. It's so fascinating. I mean, one of the things that I couldn't help but think about is like, we talk about education as like a magical tool to fix a lot of problems in the world. And I think it's true. I think it does. And if there was educational awareness about burnout early on as part of the veterinary education, I think it could make a big difference. And it seems almost that idea of like what are the people around me experiencing, and just having that awareness, I think could be brilliant. But
Well,
Mark,
can I just pick that one last concept that goes with that, is that the other thing that I think we also need to recognize in ourselves is, because some of us were high performing, although I still don't necessarily think the imposter syndrome in me says, well, how on earth did you get in? But that's beside the point, maybe, is the fixed mindset and growth mindset concept that Carol Dweck was so instrumental in understanding. If you are bright and you're constantly told you're intelligent, you're beautiful, you're tall, you're handsome, you're all these nouns, if you're told all of these things, you become a believer in that. If somebody says that you're, intelligent for 50 times a year, you sort of believe you are.
Sean
And
doesn't have
then
that problem.
when things start unraveling, you're suddenly, instead of being brilliant, you're suddenly a catastrophe. And disaster, and useless and a failure. Whereas actually, if we were told that, gosh, you worked hard on that when you were a child, for instance, colouring that picture, I love the selection of colours that you did there, and I love the curves of those lines and the way you showed the, whatever it is. The growth mindset is all about verbs, and you worked hard, you did this, all of that. So when things don't go right, you're not a failure. You were working hard, you were applying your knowledge, things didn't quite work out, but you're at least not black and white success, failure. Maybe there's an element of that too. I really admire what that concept, and bright people, and as veterinarians, I think we could suffer a little bit more of fixed mindset than is good for us.
yeah, it's so interesting, Mark. So I think we're out of time, but such a fascinating conversation, and I wish we could keep going. I guess we're going to have to have you back. So we like to wrap up the show same way every time. So the first question we've got for you is a book, a YouTube video, TED Talk, something you found inspiring, insightful, or interesting along your path to this point.
Yeah, I guess to me there is quite an interesting. Well, there's really two, and it's fundamental. Is the Start With Why by Simon Sinek, which is fundamental to why did I become a veterinarian. It wasn't the love of animals, it was the human-animal bond, and it took me a few years to verbalize that. And if I'm allowed another one, it's 12 Birds to Save Your Life by an author called Charlie Corbett, and going through his grief and experience of losing his mother, and the way birds around him helped him on that journey and come through it. So if that's too naughty, I would recommend both of those books for the audience, for very, very different reasons.
And the second question that we ask, is there guests that you would suggest joining us on this podcast?
And it sort of follows on really from the why, because the human-animal bond is, I think, why a lot of people enter veterinary medicine, certainly why I did. And Elizabeth Ormerod is an extraordinary individual. She was very much as a founder of the Society of Companion Animal Studies. Her knowledge, experience of building what the bond-centered practice, and the importance of looking after the socially isolated, the frail, around her to help her build her practice is fascinating. She's an extraordinarily well-respected lady from Scotland. She's actually a co-trustee of our Special Friends, which my wife set up and I'm also involved with. The stories that she has about how to build your practice based around looking after folk that you might overlook in society, and the benefits that can have on your practice, Elizabeth Ormerod will be that very person.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.